Hi everyone, my name is Casey Williams. I am going to do a presentation on the pathology of breast cancer for Nurse 673 Advanced Pathophysiology course. So, to get started, we will give an overview of breast cancer. In 2019, the cost of breast cancer was higher than any other cancer. Every woman has a 13% chance of developing breast cancer in their lifetime. And the chances of any woman dying from breast cancer is 1 in 40. So that's a pretty significant amount. The cost of breast cancer, just to kind of further elaborate on that, in 2019 the total was $3.14 billion. um, and that is higher than any other cancer expenses. So this can be financially demanding on patients for a number of reasons. One would just be that the treatment and things like that in general, the medications. And then another reason is because these patients have to miss, if they're within their working years, and not have not retired yet, they're missing a lot of work attending these doctor's appointments, and ultimately that leads to less income. So it's financially demanding on the patient as well as physically and emotionally. Um, in breast cancer is the most common cancer in the United States, and approximately one out of every three newly diagnosed cancers is breast cancer. So it is definitely worth going ahead and educating those patients not to miss that mammogram. It's pretty prevalent, unfortunately. So moving on, the pathogenesis of breast cancer. So essentially, cancer is diagnosed when the DNA of a cell is changed. So it can be changed by modifiable factors or things that the patient cannot help, such as like genetics and things like that. So when the cell is changed, it's then unable to regulate normal cell growth. And so the body begins to have a rapid regrowth of cells and the overgrowth of the cancerous cells. And it then can lead to tumors and or metastasis. So some types are more aggressive than others, but it essentially all starts when the DNA of a cell is changed. So the clinical manifestations, this can be changes in the breast size, the color, the contour, and the shape. This can also manifest as just nipple tenderness, and discharge from the nipples can also be another manifestation of breast cancer, and then a lump around the breast or the armpit. So it's just very important that the patient does her regular exams on herself, even in addition to the mammograms. So the woman may notice a bloody or clear discharge that comes from the nipples. There may even be a mass or a lump that is present during her menstruation cycle. The skin around the nipple may even appear flaky, irritated, or indented. Additionally, there can be discoloration of the nipple, and it can appear purple, red, or just even a darker shade than the other parts. So it's important that the woman knows what her breasts look like to begin with, so that way if there are any differentiations that occur, that she would know that there could be something going on. And women can have nipple tenderness during ovulation, or during their menstruation cycle. So it can be tricky if maybe just one or two of these symptoms appear. It can be tricky for the woman to catch on to that this is breast cancer. Moving on. The diagnosis of breast cancer can be made through a number of things, but we're going to hit about four of them today, just to discuss. So one of them is a diagnostic mammogram. So, like I mentioned, they can be routine, but when it comes to diagnosing a patient, the diagnostic mammogram is a little bit different. The images are a little bit more diverse in angles and more detailed in the quality of them. So that's why they're used for the diagnosis. An ultrasound is an additional diagnostic tool that can be reused in order to rule out or confirm breast cancer. So, an ultrasound consists of sound waves that travel throughout the body to take images of the desired area. It is not invasive, not near as invasive as a biopsy. So, a biopsy during this, tissue is removed from the desired area and it's sent and tested in the lab. So, this is a definitive way of diagnosing breast cancer. So, if obviously if cancer cells are found in that biopsy, that is when they are diagnosed with the breast cancer. And then the last thing that we're going to discuss is the tumor marker test. So this test can be a good factor in determining the success of cancer treatment. So everyone normally has tumor markers, but they just are at a rapid rate when breast cancer is present. So moving on, the implications for nurse midwifery. So the main thing is education. Educate patient on self breast exams, educate patient on risks and the modifiable risk factors, especially because if they know that they're maybe more at risk because of oral contraceptives, or maybe this is something that has run in their family or cancer is prevalent in their family, then they need to know these modifiable risk factors in order to lower their chances of obtaining breast cancer. And not that that is 100% going to eliminate their risk, but anything helps. So, and then last, the nurse midwife should complete a thorough health history, understand the patient's past history, understand their family history, and just educate those patients on the importance of keeping those routine mammograms. And prevention. So, prevention can come in all different ways. You can lower your risk by exercising regularly and maintaining a healthy weight. Um, Regular screening for breast cancer is key, and do not smoke tobacco or drink alcohol. The breast cancer can be caused by many modifiable risk factors, and like I mentioned above, lack of exercising, smoking, alcohol, and being obese are some of these. So, by losing weight and avoiding alcohol and implementing smoking cessation and becoming more active, an individual can lower their chances of developing breast cancer. And so, if education is offered in regards to ways to decrease the risk, hopefully the goal is that less diagnosis of breast cancer will be made just because the prevention is increasing. Being aware of with breast cancer and the risk factors is really the main thing. So treatment, there's many different treatments. We're going to discuss chemotherapy, radiation, lumpectomy, or mastectomy. So chemotherapy is it just consists of highly potent medications that come in many different forms. It can be oral or IV. Radiation, however, is a powerful treatment that uses high energy beams that are a form of X-rays or other types of sources. So it's also important that both chemo and radiation, it's important that you know and understand, and even the patient understands that these can come with some pretty significant side effects as well. It's always important to educate the patient on these side effects. That way they are making an informed decision about their care and about the treatment that they are choosing to go with. So a lumpectomy or mastectomy, this is another way to treat breast cancer. So a lumpectomy is actually just when the breast cancer and the tissues around it are surgically removed. But a mastectomy is when all of the breast tissue is removed from the breast. So one is trying to save a little bit while the other one is they're just taking it all out. So, and also I wanted to say that chemotherapy or chemo and radiation, they can also be used in addition to a lumpectomy or mastectomy, maybe to shrink the size of the tumor before they go in and try to remove it. So here are our references, or my references. And I appreciate you listening to this video. And I just wanted to say that I learned a lot about breast cancer, and this will even be beneficial to myself personally. And I will make sure to educate my patients, even more so now that I realize the prevalence and the risk of it. So thank you guys.